Hey everyone, welcome to the Neurodivergent Perspectives podcast, the podcast where we get real about the neurodivergent experience at work. I'm your host, Dr. Allison Leaños, neurodiversity researcher, educator, and deeply passionate about neuroinclusion, who spent years studying one big question: what is it really like to be neurodivergent at work? The answers? Hear from my guests. Let's go. Okay, we're here with my guest, Stefani Schuil, on Neurodivergent Perspectives podcast. Stephanie, do you want to say a couple things?
Hi, I'm Stephanie. I've known Allison for a little bit, and we've discussed about her work with neurodivergence and neurodivergence in the workplace. And I was not diagnosed until late 20s, early 30s. So I was already well into the workplace when I was officially diagnosed. And so we've had some definitely candid conversations about the challenges that come with that, just even challenges of just being an adult and not even knowing you have it. So that I guess is kind of a nutshell, I guess, the beginning.
Yeah. You were diagnosed, so being diagnosed as an adult, but when did you first realize that your brain worked differently?
So first in my adult career, I really took a career path that was actually very good for neurodivergence. So I didn't know because, we do well in crises, and working in the emergency department as a nurse, I mean, that's what it is all day, every day. And
Yeah.
my dopamine was up here and I was loving life. And it was fantastic. I didn't notice and then right after that, I went into flight nursing. Again, crisis after crisis after crisis. You have to be high functioning in those moments. So again, I still wasn't picking up on it. Was I having challenges? Absolutely. But there was nothing at that point in time that still made me question, did I have doom piles everywhere? Yep. Did I have my laundry stacked up? Absolutely. Not even stacked, just in a pile, clean but not folded. Absolutely. But I just thought, well, that's just part of who I am, whatever. So I think actually when I moved in with Henry before we got married, is when I started to notice it because, uh, I had already gotten used to kind of how he was as a person, definitely more, not messy like myself and, more neurotypical, but I didn't know that's what it was. I just thought, I'm the, chaotic one. Hey, how fun am I? And he's just very straight and everything's done and, politely packaged and looks all nice, whatever. So I think once we started living together, living with somebody other than a family member or a best friend or something like that, it was more eye-opening, no, because now the way that I'm living affects somebody else. And they're like, what's wrong with you? You could put this dish away or you could right away as opposed to letting it stack up. Just makes sense, right?
Yeah.
Or how does this
What
not
do you mean you don't like my doom piles?
yeah, what, that's a problem? I thought, if it's, and I straightened my doom piles up because I did understand I was living with somebody, but they still existed. And I think once that happened, and also, working in flight too, my schedule was, I guess you could, weird, dynamic with my days off, but I would be so depleted. I would get nothing done. I had no motivation. I was just, and so I finally, and I had seen a therapist not for that. I just had a therapist that I would see weekly for maintenance, if you will. And I also have a neurologist who I've seen for many, many, because I have migraines and I also have epilepsy. So he's incredibly smart. He deals with neuro as well as some of the psych sides of it too. And so I was talking to my therapist one day, my psychologist, and I was like, man, it was something online or something that I had seen that I kind of resonated with. But again, it's online, so I don't know, can't fact check this or whatever. So I was like, I kind of have some of those symptoms. That's so strange, and I was like, and I remember something as a kid where I did this and my parents were really upset and they took me to a therapist and I couldn't understand why. I really in my heart fought against it. I didn't understand it. And I was like, maybe I have ADHD. And she was like, I can't diagnose you, but if I could, given my experience and everything, she was like,
Yeah.
I'd probably say so. And then when I was talking to my neurologist, he said the same thing. He goes, oh, absolutely. But you're so successful. I'm not going to bring it up to you.
He's like, I'll let her discover it and then come to
Yeah.
me and I'll endorse it.
Yeah. And so I was like, and so at first I felt like just a wave of relief because I was like, I finally have something to explain a lot of these things that, yeah, they're a little odd. Like, but I just went with them. I don't know. Maybe I just thought of myself as quirky. I don't know.
Yeah.
But so it did start to kind of help me like start to read things and process. Okay, this is actually
Mhm.
a behavior from like not from that, well, yeah, I guess from that, but and maybe this is why I do that, so I can at least
Mhm.
like, put something to it and kind of make sense of it. And at first, they asked like, do you want to try, because around that time I was really struggling with just getting anything done at home. Like I just could not, and I don't know if it
Mm.
was because I'd be like so depleted coming home from work from the adrenaline high and all that kind of stuff, from
Right.
because I would come home from 24, 36-hour shifts. And so I just wasn't getting anything done. I wasn't being productive like human at home. Like it was just, yeah. So that's when I really was like, okay, something needs to change. So I tried Adderall and I didn't like it. I did like the productivity aspect of it. I did get a lot of stuff done.
You're
I
like,
just didn't like
"Laundry is folded. This is great."
everything's done. It was actually funny. Henry came home one day from work and he was like, "Oh my gosh." And I had gone out and done like a million errands and I don't even know what else around the house. And he was like, "That's so much stuff done. Oh my." And I was like, "Yeah." I was like, I was trying that Adderall today. I took it to see what would happen. He goes, and he's like, "I mean, you can do what you want to do, but I think it's really effective." And I was like, "Oh, yeah, I guess so." So I did it for a while, and then I was just kinda like, I don't really like how it makes me feel, so maybe if I take knowledge and apply it to what I know, what I
Mhm.
struggle with, which doesn't always work, but I try because I really don't like to be on the medication. I do have friends that were also diagnosed actually in the last few years and
Yeah,
similarly, and they actually really benefit from it. They take it every day, and I'm like, "Oh, good for
that's
you."
great.
Yeah.
Yeah. Everyone, listens to their own body and they do what makes sense for them. And did you know that nursing was going to be a career that really fed into your ADHD and brought out like the best parts of your ADHD? Like it
Not
just
even in
happened
the
to be
slightest.
like a coincidence?
I think so. Since I was a young age, I knew I wanted to be in the healthcare field. So I already had grown up with that idea. And then when I was in high school, I was like the office girl at a doctor's office, if you will. I did all the filing. I was like the front desk girl, answered the phones. And there was two nurse practitioners that worked there. So in essence, I kind of got to shadow and see and just really immerse myself in healthcare.
Mhm.
One day I read this book. It was called Trauma Junkie, and it was about a flight nurse. And I fell in love with this book. I fell in love with everything she did. It was also a female. And I was just like, that's what I want to do. That's what I want to do. Not like I want to go and be a doctor or maybe find out in the healthcare field. I want to be a flight nurse. Not just
Yeah.
any nurse. I want to be a flight nurse. And then later I actually was like, I probably will never be a flight nurse because of like the epilepsy and everything. I was like, that's probably never going to happen. And then I proved myself wrong and I was able to do that for 5 years. Could have done it longer. I just wanted a different style of life.
Yeah.
But no, I really didn't know, I guess, that because at that time, again, I was still undiagnosed. I had no idea that it was going to feed my energy or my levels, the chemistries in my brain of what I need. I thought it was just feeding my soul because I do love taking care of people. Even if it's not in a
Yeah.
traumatic, crazy environment, I still love taking care of people. Absolutely. And so to me, that was still just the heart of it all.
And
I
maybe
wanted to work
would
in the
you say like
emergency.
even like the unpredictability of being, because I mean not all nursing specialties are the same. There's like floor nursing and then there's,
Yeah,
ER and trauma and flight, but do you think that the specialty that you went in, the unpredictability of it, or like, okay, I'm clocking in for my shift.
yes,
I don't really know what kind of patient situation is going to happen today. Is that like kind of like the most ideal kind of environment for someone with
100%.
ADHD?
Yes, if you put me on the floor because there's so many nurses in my family now. So like my brother, he's an ICU nurse. Actually, he's finishing up his NP right now. His wife,
Nice.
she's yeah, I know. I'm excited for him. They're both neurotypical. So she works on med surge, which is God bless her heart. I couldn't do it. The schedules that the ICU and med surge have, like I don't like a schedule. Throw it away. I can't. I can't. Things will not get done if you give me
Yeah.
that. I know some people do better because they can like check off a list. No, no, no. No,
Yeah.
I need constant, just like you said, like I need to pivot. I need to pivot. I need, boom, boom, boom. Something else is demanding my attention. Thank God, because this just got boring. Like Yes, I think, I don't know if some subconscious part of me figured that out when I was like doing clinicals or something like that. I was still very young. And so I still had that,
Hmm.
like, I just want to make a difference no matter where I work. But I knew like I didn't want to do anything other than ER or potentially psych at that point.
Yeah.
Psych, I don't know why. Maybe just because it's interesting to me.
Yeah.
um,
All right. So, for anyone listening, and if you have ADHD and you want to go into the healthcare fields, emergency nursing
yeah.
is your place.
And you'll find other people just like you. Trust me, the amount of either men or girlfriends that I have from emergency nursing, there's so many of us that have ADHD. We just found out along the way. We're highly caffeinated, just buzzing all the time. So, and you'll be amongst friends.
Yeah.
Yeah.
So, when you were first navigating the workplace, like your first job, how did you navigate that with your ADHD? If you could think back to the very first kind of work experience.
Like, as in my career or just ever? Because when, like, my first job, I worked in retail
Oh.
in high school.
Which also can be quite unpredictable. I worked in
Yes.
retail too.
Yeah.
I guess like let's talk about your career. So, how did you navigate it? You probably didn't have a diagnosis yet, but you knew something was going on. What were some of the ways you navigated it when you're like, okay, something's going on, but I'm not sure what?
So I remember, and this may not be directly in line with like ADHD per se or how to navigate it, but when I would be having difficult days and I
Hmm.
wouldn't quite, again, I didn't know, I didn't understand
Hmm.
what was going on. I just thought, oh, it's a difficult day, or I'm not getting it, or why do I feel like I'm not 100%? I did have a mentor in the ER. He's one of my charge nurses. He very much, looking back, has ADHD. Actually, he did tell me one time where he took Ritalin at a party and like calmed down, like when he was young. Anyhow, so yeah, he for sure
That's
has
so
ADHD.
like was he expecting a different effect?
Yeah, it was like when people were
How
just like
funny.
popping pills to to party, and he was like at a party or
He's
whatever
like,
in
I'm ready
college.
to read a novel and sit by the
Yeah, no,
fire.
he said I literally he was like, and if you ever met him, you can spot it a mile away in him, but still he goes, "Yeah, everybody's all like partying and have a great time." He goes, "I sat down and was like, hey guys, this documentary's on. Like, let's watch this. This is cool." And he goes, "Yeah," he goes, "It was so boring for me to be like, yeah, we are supposed to take this upper and have a really good time, and now all of a sudden I'm focused."
Oh my
um,
god.
yeah, I was like, "That's hilarious." Again, still had no idea about myself, but, there's maybe another reason why I was able to, like, see him as a mentor too, and he was able to bring me under his wing. Maybe he saw something in
Mhm,
me that was very,
mhm,
just different. So he had once said, because there was, I don't know, I must have had like a bad shift or something and felt bad about it. And I was just like, I know we were talking before about, you know, kind of that idea of perfection or people pleasing. You're just like, I need to be 100%. I need to be perfect. Like today was not perfect. Like I didn't do my best. Why didn't I do my best? Or what does that say about me as a nurse? Oh my God, I'm a failure, and I've been a nurse for like all of a year. 24 years old or something, like, yeah. Um, and he was like, "You know what?" He was like, "Nobody ever can give 100% every day." And he
mhm,
goes, "And these days are gonna continue to happen, not every day," but he's like, "You're young in your career. This will continue to happen." He goes, "And you can't burn yourself out thinking about all the different things you could have done or to be perfect." And
mhm.
nothing catastrophic had happened or anything like that. It was just a bad day. Nothing, let me preface that. Nothing bad happened. But so I was like, well, but how do you cope with that? Like, I struggle with like that idea of not being perfect. Like, I do go home and beat myself up if that was the way. And he goes, no. He goes, if you gave 80% today, come back the next shift, whether it's tomorrow or next week, whatever, and give 110. And if you gave, whatever it is, because nobody ever has that level of perfection every day or that
Mhm.
100% that they can give every day, especially when life hits you with, whatever else it chooses to. He's like,
Yeah.
just remember that you can come back the next day and prove yourself wrong
Mhm.
and give it that extra mile that you didn't give it today. And that
Yeah.
resonated with me. It helped me. Again, still didn't know, but I knew that, started to see that things were not the same for me as they were for others.
Yeah.
At least some people. Again, when you're in the ER, you're amongst friends. in the ADHD world. So you may not always know right away.
Yeah, there's probably a lot of neurodivergence working in emergency medicine. It needs its own conference,
I I would love that if
like
we could
first
make that happen.
responders.
There actually was a first responder one that I went to, actually. It is a little chaotic, I'll put it that way. Maybe there are too many in one place.
Yeah.
Yeah, it's like
Too
an
much of a good
emergency.
thing, I guess. Yeah.
No, but I agree. Like, why not put us all in the same bag? But I just remember thinking it was a weekend of, it was out in, I think, Indian Wells. It's just a weekend of EMS, ER people, fire. I don't think PD was involved, but you just see all like the healthcare workers from EMS get together. And it's kind of like a weekend of just debauchery. Like, everybody is just like, thank God I'm not at work. I'm going to drink like crazy. I'm going to do, whatever. They have like a, what do you call it? Not poker night, but like a casino night. They had a casino night. I was like, "Oh my god, like, they just get us gambling and drinking. This is not ideal for our situation." But
Oh
very
my God,
fun.
it's too funny.
Yeah.
Do you ever feel like you need to mask your ADHD or hide aspects of yourself to fit in at work or help your career at all?
Yes. In the career kind of turn that I've taken now, I'm not in emergency anymore, but I'm in trauma, but on a different side of trauma. I'm not necessarily in the mix of it. I do more performance improvement. So that means I am at a desk a lot. I do go to traumatic active like trauma activations and different things like that. And I do go to see patients in the ICU, but I'm not like their actual nurse. I'm not doing the treatment in that
Hmm.
sense. It's a very, very interesting job, just considering all the different jobs I've done. And I have a lot of knowledge that I get to bring to the table, but putting an ADHD person in front of a computer has its challenges. And that's me. I put myself there. Don't like, no, that's only my fault. But it's been probably the biggest challenge of my career to adapt. There are some days where I'm like super proud of myself because I'm like, okay, I sat and I hyper focused for at least 8 out of these 10 hours. I'm like, that's
Nice.
a win. That is a win. But then there's those days where it's like, God help me. Like, I need focus. Like, and those are the days where I have so much caffeine. It doesn't
Yeah.
even work anymore at that point. It's like, oh, what's the point of this? And those days I feel like I am masking a lot.
Hmm.
Just because it's kind of hard to tell your coworker, like, I mean, you can say I can't focus today. I mean, that's a fairly blank statement that I feel like it could get away with. But if it's just like, oh, I'm overstimulated, I'm like, how can you be overstimulated when you're staring at a computer?
Yeah. But it's
I'm
possible.
overstimulated. Yeah, I know it's possible, but somebody who's not neurodivergent might be like, just take one piece at a time. And I'll be like, I don't see it that way. I don't see it as just like
Yeah.
one piece and another piece. I see 5 pieces and all of them need
Yeah.
my attention right now, but I can't make that happen in this particular, like in front of a screen. And I like the fact that the job challenges me in different ways.
Hmm.
Of course, like, I mean, again, feel like that's very much part of ADHD too, is I'm still seeking more, like, I'm still seeking challenges. I was definitely challenged in the ER. I was definitely challenged as a flight nurse. Now I'm seeking a different type of challenge,
Hmm.
but it's still, I think, like, treats my brain in that way. But but then there are those days where I come home and I'm just like completely defeated. And I'll talk to
Yeah.
Henry and I'll just be like, I just don't feel like, I don't feel like I did anything right today. I don't,
Mhm.
there's times where I'm like, have you seen those? This is so silly, but have you seen those ADHD like desk chairs that they say are like meant for people with ADHD? Have you seen
Yeah, they're
them?
like,
They're like
well,
swivel, like they've got like 3 different pieces that like
yeah,
swivel and
so
stuff.
so
Want one
at
of
the
those.
University of Laverne where I did my doctoral program, there's a place called the Collaborative,
Cute.
and it used to be the Center for Neurodiversity. So some of the furniture
Mm,
in there is like neurodivergent friendly, and they do have these like swivel chairs.
yes.
And I actually, as a neurotypical, I sat in it for a little bit. It hurt my back a little bit. It actually like it didn't work for me, but I could see how it could work for somebody who has the wiggles or who like needs to who's like just a wiggly person, maybe because of their ADHD and needs to just be kind of like bouncing around a little bit, but it helps them focus. But I mean, it was fun to sit in, but after a while I was like, oh my gosh, my like lower back hurts. I don't know if it was like an age thing or like a neurotypical thing, but and then they have like cushions that you can put if you have like a standard desk chair, you can get these discs that kind of wobble, and
Ooh,
one side is smooth and one side has like little bumps on it if you need that kind of sensory input.
I'll have to look into that. That sounds
Yeah,
fun.
yeah. You know what they should have? So for kids who are neurodivergent, they have these chairs that go on the floor and they
Mm,
turn like a little swivel.
cute.
And the kids can turn in circles to get that
Just
input
to
that they're
ease their.
seeking. Can you imagine if they had one for adults and you could put in your office and just sit there and
Yes,
just
I'd
spin?
be just like, "Yeah, get my work done." I would I would actually be able to do it, or if I needed, like, a spin break, just be like, "Give me a minute.
Yes, yes,
I'm
a
setting
spin
a
break.
timer. I gotta do some swivels here. I gotta do some swirls."
Yeah, yeah.
So, I've been telling Henry, I was like, "I need to get that desk chair," because one of my friends got it, but she got it for her house, and she loves it, but I don't know how much. Well, no, she actually just finished getting her master's, so, yeah, she probably sits at the computer a lot.
Yeah,
But I
yeah.
notice when I'm at work, and actually I don't think you'll be able to see now, and plus I keep telling myself not to do it, but I bring my knees up a lot. Like, I bring my knees
Okay.
up, or I do twist, or like I don't like twist like incessantly, but I bring my knees up a lot, and then I'll bring one down and then the other one and this and that. And of course, like I have like an L-shaped desk at work, so at some point I'm like I'm probably bruising the crap out of my legs.
The
Just
the
like
ergonomic team is just rolling their eyes at you.
yeah, they're like, "No, like that's not good for you." And I even have one of those little like sciatica pillow chair, like, in my chair.
Yeah.
Doesn't I don't think it actually works. I think it makes me more uncomfortable. But
I wonder if those, like, big bouncy ball chairs would
yes.
help, because then you can kinda bounce a little bit, but you could be do a big bounce or a small bounce depending on how much wiggle that you needed to
Yeah.
do. Yeah.
That's a good idea too. Like, honestly,
Yeah.
I do sometimes I think because I have, in my office, my coworker, my work partner, specifically, his desk is, like, right it's adjacent to mine, like, they're both L shapes, and so they, like, frame the room, and I
Yeah.
always think to myself, I'm like, "I'm probably annoying him," but I've asked him, I'm like, "If I'm annoying you, just tell me to stop," and he's like, "No, no, no," he's like, "My sister's the same way you are," he's like, "I'm fine. I can just," which is great. It's good news for me because if I had somebody who'd be
Yeah.
like, "Just stop," I'd be like, "Well, we need to change offices because I can't." It helps
You're
me
like, "This is who
focus,
I am."
and this is the only way I'm going to be productive. But
Yeah.
there's been a couple times where, like, just straight up, like, I've gotten up out of my chair and I'll be like, "I'm going to be back. I need to go for a walk." Like,
Mhm.
I'm going for a walk. I have my phone. If you need me for anything, like, obviously, I make sure I don't have any meetings coming or something like that, and then I'm
Mhm.
like, okay, because I just need like, I don't even know. I'm just overstimulated. Couldn't even tell you what it is right now. I just, like, just overstimulated, like,
Yeah.
and yeah, and so I've had to do it a couple times, not too often. There are a couple or there's different things that I get to do at work that means that I'm not at my desk for, like, the full 10 hours. I mean, there are some days
Mhm.
where I am, but so I take those opportunities to get up and move because, yeah, sometimes I feel like it is just the wiggles. It's like I just need to avert my eyes or I don't even know, take a doom scroll break, you know?
Yeah.
Like, let me take my eyes off this screen just to look at this screen, or whatever, but at least it's giving me a little bit of a rush, or a
Yeah.
change or, whatever the case is. So, I definitely feel like I mask more in the workplace that I am in now. I know I spoke to you before when I was, transitioning the first time I transitioned from flight where I was doing education, nursing education. And I feel like at that job, so when I was up at teaching, I was
Mhm.
in the zone. I love doing that. I love being forward facing. I love seeing the minds. I love teaching like to make it
Mhm.
work because not everybody's brain is the same as we know. And some people learn differently. And you can look at them and you can tell like that person is not into this. And I'll be like, all right, here we go. Now let's figure this out. It's a puzzle for me. I'm going to make this work. I'm going to make everybody have a good time in here. That I loved, but when I had to sit and work on lesson plans and, different projects, stuff like that, sometimes the focus would be really hard, and there, I did have to really, really mask. I would say in my
Mhm.
job now, um, I can be more vulnerable about my needs
Mhm.
and have them seen, if you will, but there it was like, no, I had to mask it, like, there was people around me that, let's say, were very condescending
Mhm.
and which was triggering of my childhood, so that was not
Yeah.
helpful, but that would kind of trouble me a lot in the sense that it's like I'm not ever going to make an excuse for saying that my ADHD is I'm never going to say that's the cause of why something's late or whatever, which normally I
Mhm.
never turn in anything late. Deadlines that's fine. I'm never going to use it as a crutch like that, but I may
Mhm.
need to be like, I need to take this walk. Like, I don't want to have to tell you why. I'm fine telling you why. I don't have any shame about it, but I don't
Yeah.
certain people will see it as using a crutch. Like, oh, you're just saying that so
Mhm.
you can get this or you can get that. No, I don't want anything from you. I don't need anything other than I just need to take a 5 minute break. I just need to look. I don't even care if I'm looking at the wall. I need to not be doing this for a second. like,
Right.
or the way that you are talking to me does not work for me. It will not
Mhm.
change my behavior, not behavior. It's not like I'm acting up. It will not change whatever it is that your angle is for the better. Like there it was very much I had to mask because it's like I couldn't just be like, "Hey, this is kind of what I need right now to be
Mhm.
successful." That wasn't the case. It was,
Yeah.
you know, "You're an adult, figure it out." And that's fine. Yes, I am, and I will figure it
Mhm.
out, but I got to do it on my terms.
So
So that
environment
was
so
my
leader behavior and like organizational culture play a big role in whether you feel safe or not to put the mask on or take it off.
yeah, I think so.
Yeah. Yeah.
For sure. Definitely colleagues too, I think.
Mhm.
My colleagues there actually in the education role, some of them had similar issues I did, if you will, like similar diagnoses. So that wasn't the trouble. It was more like you said, the leadership,
Right.
which I have no problem answering to. That's not the issue. It's the style, like you said,
Mhm.
or the ability to feel safe to be like,
Yeah.
hey, I'm struggling on this end. Could we just do it this way? Or, not even, it's not like I'm asking for special anything, but other than just like, please let me process my way. The work
Yeah.
will get done and it'll get done very well. Trust me, I'm not going to produce anything that's not, but let me process my way.
Yeah. So we talked about the chair situation. Are there like other accommodations that you've used or created yourself to help you thrive in your environment as someone with ADHD?
That's a good question. I usually always have music playing. And if
Mhm.
I don't have it playing, then I at least have like a headphone in and then I'll have it. But I feel like that's a lot of people these days, really. So I do that helps me a lot, like silence. I don't normally get a lot of work done in silence. So I need to be working. The other thing is I talk to myself a lot. And luckily, again, I have a coworker that doesn't phase him. He'll tune it out, which I'm thankful for. By because I'll just be over there talking to myself or cursing at the computer or what have you because of whatever, and he doesn't mind at all. He's very understanding, so that's good because I need to be able to talk. And luckily, I don't sing. I did that at my previous job, but that's also because my coworker who has a similar diagnosis, we had the echolalia, like back
Oh
and
my
forth from our
god.
offices. Yeah,
I
Celine
l
Dion.
I love echolalia. My son does that, and we just, like, get into, like, good jams
Yeah,
sometimes,
it's
like,
fun. It
just
really is
repeating the
fun.
same thing, you know?
Yeah, you're making up your own, like, little
Yeah.
song or thing or whatever, and you're just like, "Yeah, I get it, that's right." Yeah, she and I, we were, like,
Get
2
down, yeah.
we were 2 offices down from each other, and she would, like, I don't know, sing some phrase or say some phrase or whatever, and then, like, I'd finish it, and she would be like, "Yes!" And I'd be like, "I know, I've got you." And the other people in the office would just be like,
You're like, "We're
"But"
stimming, it's fine."
exactly, "Just let us stim, and then we won't bother you, really."
Yeah.
But yes, now I don't do that. I at least keep myself quiet, not singing or actually, that's not true. Sometimes I like sing like at a humming level to myself.
Mhm.
But
Yeah.
I definitely have some tactile things and my desk is colorful. I have I don't know what to say, but just different things that I guess I like to look at. And I'm not talking about like a photo per se, like different things that just I guess I look at and make me happy.
Like, kind of satisfy that visual input that you're looking for that
Yeah,
isn't a
yeah.
computer screen?
Yeah. Yeah, I can look around and certain things that, yeah, like I like to look at more than others or whatever. And then, yeah, like I said, it's colorful, not like as in colorful like the rainbow, but purple and like rose golds and everything. Those are all like
Mhm.
my favorite type of things. So, like, if I cover my desk in those things, then I'm, happy and I've got my squeezy balls and I've got different things that just tactile like make sense, like especially if I'm like just reading something, I don't have to be typing and then I can sit there and squeeze and do all different,
Mhm.
pull
Mhm.
and whatever stuff that I have that I feel like I need to to do to stim or to get, my focus back or just to, help me kind of release some energy.
How open are you at work about your ADHD?
I have no problem saying that I have it. I really don't. I
Mhm.
think my biggest fear is that people will think that I'm using it as an excuse for something.
Mm,
And that's never the case. I will never do that. It's more like just understand that I do. So if maybe my way of doing something seems weird to you, you might understand why. And again, I'm in a very like safe environment, if you will, now. But I don't have a problem. Um, I don't feel like I need to ever keep it a secret or anything, but that's just my biggest hang up is I don't want anybody to ever think that I'm using it as a pass for any sort of behavior.
yeah.
And that would be the only thing that would give me pause about saying it. But more
Mhm.
often than not, I don't mind. Some people can see it a mile away, like you did.
Yeah.
Be like, you have ADHD, don't you? Guilty.
Um, yeah, I mean, my dad was dyslexic. I have a sister who's neurodivergent. My son's neurodivergent. So, yeah,
You're like, I, I see it.
I I can see it a mile away. Yeah.
Yeah.
Someone will share a story with me about someone they know and how like, oh, they don't like it when their food's touched, and I'm like, "Are you sure they're not neurodivergent?" Like
Yeah. You're like, that's kind of a thing for them. You know what I read the other, I don't know if it was, maybe I saw a video and I was like, is that true? But about, how a lot of neurodivergent people take things very literally or
Mhm.
certain things. And so the joke of like, why did the chicken cross the road? Or like, no, cross the road, right? Yeah, that's like
Yeah.
how the joke goes or whatever. And they were like, yeah, a lot of people with neurodivergence literally just think it's when people say to the other side of the road. And I'm like, yeah, that's what I've always thought. Why would it, what? Like it means something different. And when they say to get to the other side, it's like, yeah, they get hit by a car, they die. Like they go to the other side. I was like,
Oh,
I have never,
to
I
get
was
to
like,
the afterlife.
yeah, I was like, never in my life have I thought that. I thought it was the dumbest joke I'd ever heard for my entire life. Yet to get to the other side, that's why somebody
Yeah,
walks
of
across
the
the
road.
road.
Yeah, I'm okay, so I consider myself pretty neurotypical, but
Yeah. I
I'm
wonder if it's a
today years
stretch.
old just
Yeah.
learning that it meant to be to the afterlife, the other side.
I know. I
Oh,
was
maybe
like,
I might be neurodivergent.
yeah.
Hmm,
There was
yeah,
one actually I just read this morning about like the honk, like the stickers, like honk if you like pizza or something like
right.
that. It
Yeah.
doesn't mean to actually honk because you like pizza or whatever it is that it says. And I was like,
Well, what does it mean?
yeah, again, I was like, this is weird because that's exactly my whole
Because
life.
I'm taking that one pretty literally, like, honk if you love, like, the Lakers or something,
Yeah.
or
Yeah, honk if you like pit bulls. I don't know, like, and they said it's a meta play. First of all, I meta joke or something like that. I didn't know that was a thing either, but about they're a bad driver. So if you honk, like they're not going to think twice about it really because they're a bad driver as it is. So go ahead and honk at me. Honk if you like
yeah.
pizza or honk if you, and I was like, first of all, I felt like that one was a stretch a little bit, but I was like, I'm pretty sure most of the people that buy those stickers truly actually think it means honk
Yeah.
if you like
Because 'Cause they're
whatever
like,
that
"Oh,
thing
I
is.
love I own a pizza shop. I'm gonna definitely put this on my car because I'm gonna champion pizza."
Yeah, I don't know. Whoever, whatever, again, it was just some clickbait. But when I was reading it or watching the video that they were
Oh
saying, they
my
were
god,
like, yeah,
that's
that's a
funny.
neurodivergent thing. And I was like, is it though? I think a lot of people truly think that that's what it means.
That's so funny.
Maybe when it,
That would be such a fun episode of just going through different idioms.
yeah. Oh, you're right. That would be really fun. And
You
just like being
know,
like, did
like,
you,
for
like,
example,
how did you actually
idioms
take
we
it?
some of the idioms we hear at work that would not translate well to someone who's neurodivergent is, "Hey, we're gonna put that idea in the parking lot."
Yeah.
AKA, we're gonna revisit that at a different time, but for someone who's neurodivergent, they're like, "Why would we put that in a parking lot? It doesn't sit in the car."
Yeah. It doesn't go there. Like, are we
Right.
going to go like have a field
Can't
trip
you
in the
just put
parking
it in a
lot?
folder on your computer? Yeah, that would be so
That's
fun to
funny.
just have a little like a side by side, someone who's neurodivergent, someone who's neurotypical, and put like idioms on a screen.
Yeah, and be like, "What does this mean
Uh,
to you?"
yeah,
That's
yeah.
funny. Yeah. Maybe it's not true. I don't know, but when I heard the thing about the chicken to the other side, I was like mind blown because for my whole life, I literally just imagined a chicken walking across the street, like with the
My mind is
intention.
literally blown. My mind is literally blown right now. I had no idea it meant the afterlife.
Well, I wonder it could be generational too, because whenever that joke came to pass, maybe that whole generation understood it. I don't know.
Maybe. I don't know.
I know. Now I don't know, but
um So, like going back to work environment, what kind of leadership qualities do you think are important for creating like a psychologically safe environment for people who are neurodivergent to be open about it?
patience for one
Mhm.
thing. Also like curiosity and like
Mhm.
genuine, sincere curiosity, not like a judgment kind of curiosity. I had somebody once ask me, and this is definitely what not to do. Or I guess they didn't ask me. I don't know how they phrased it, but they were like, I just don't understand how somebody who's so smart could also be so dumb. And I was like, okay, this is not my current job situation, mind you. So
Right.
don't take that. But I have received that in the past. And I was like, that's not, I wouldn't call that accurate, but okay, like that's not conducive to any, like, what do you think you're going to gain from telling me that, honestly, as far as my productivity? You're not going to get anything from
Mhm.
that. But anyhow, that's the not how to do it. So having that, like, I think sincere and genuine curiosity of like,
Mhm.
asking even some of the questions that you're asking, just like, not necessarily like, how can I help you? But for some situations, sure. Like some situations where they might be like much more difficult for me to be like, hey, can I like make sure that I ensure that you get a walk break or whatever?
Mhm.
Something just where that curiosity lies, where they're like, how can I understand you better? Because
Mhm.
understanding me better means that their leadership toward me, at least me, or they can be more understanding. Let's put it that way. Again, I don't want any free passes or anything like that because they're like, okay,
Mhm.
well, you're a little different. That's not what I'm asking for. Just more like, I think having that patience and that understanding of like, oh, okay, maybe you need a little bit less time in the chair or a little bit
Mhm.
more time to focus, because it does take me a minute to actually zone in on what I'm doing.
Yeah.
Getting focused in the morning takes me a little bit. I got to kind of get my whole situation set up. I got to make sure that my coffee, everything, I have all my drinks. I've got my water, my coffee, my juice, whatever. um, like preparing my area kind of a thing. So I think those mostly just like having the curiosity,
Mhm.
sincere, not concern, but just willingness to understand, the patience, and then trying to be understanding, I think
Yeah.
are big things. And
Mhm.
actually, I would say not micromanaging. I do
Right.
understand there are some people that maybe need that potentially, but
Mhm.
for me, that does not do me any favors at all.
Mhm.
So also that kind of tone too.
Yeah. What do you wish employers understood but often don't about neurodivergence?
That's a good question. I think sometimes understanding that it's not like, I think some people still have the understanding that ADHD just means like you're hyper. And it's like,
Mhm.
no, 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 it actually doesn't. There's some times where I'm truly exhausted and you're going to look and be like, why? Like, what exactly have you done that's made you so exhausted? I think maybe understanding that. So if for some reason I'm like, I'm tired today, or that meeting really drained me, or whatever the case is, it's not because of, it's like, oh, you're supposed to be hyper all the time, or, you're supposed to have tons of energy or something like that. No, no, that's not the case. It's
Yeah.
not all about the outward behavior. I have a lot going on up here, like a
Mhm.
lot, all day long. I'm
Yeah.
constantly like, my inner dialogue is, through the roof sometimes, so just, I think that's still somewhat of a common misconception. Maybe not
Yeah.
for everybody. I think maybe some people have a greater understanding now that more awareness has happened.
Mhm.
And also, they kind of just expect you to be an adult and sit tight in your chair because, you know, well, when you're my age, you're not supposed to be like having zoomies around, like,
I love that we're calling it zoomies. Like,
yeah,
I
I
have
have,
ADHD, I get these zoomies occasionally, it's just how I am.
just let me run it off. It'll be over before you know it.
Right, that's funny.
Yeah.
So, basically, like, you wish that they understood that neurodivergence presents in non-stereotypical ways. Like
Yeah.
ADHD does not equal hyper. To really understand that there's just different ways that it presents and everyone is different.
Yeah. Yeah. That's To summarize it for sure. Yeah, everybody's
Yeah.
different. You're gonna get a different view of it. You might have somebody who's incredibly sensitive, and that is like their tell is how
Mhm.
sensitive they are, or um, whatever the case is, it's not gonna look like a cookie cutter experience of what you think it is.
Yeah.
So
If you could redesign the workplace, what would be the first thing that you would change?
I think in the office setting, I would just how it's set up, you know, just try to make it more kind of like where you said that you did at the University of Laverne, that building or
Mhm.
that where you were able to study and stuff. I think that's an awesome idea. Not saying that it can happen in all workplaces, but I think that's having at least some little items such as that would be pretty cool, you know?
Like where you could have easy access to chairs that wiggle, or, sensory friendly chairs or chairs that allow you to wiggle a little bit or access to noise canceling headphones or
Yeah.
just like, different tools that could help someone with neurodivergence.
hmm Yeah, absolutely. Just little things like that, nothing like crazy, nothing chaotic. When I was at Chalk, they had a Zen room for the ER off to the side. And it was like you go into the room and it's dark, dimly lit, and there's couches and there's like a diffuser with like eucalyptus like going through it or something like that. And you didn't have to go in there and they had like little chocolates and stuff, but they were like, if you need a moment, you know, come on in here. And it was just this nice little dark cave to kind of just like quiet down. Cause, yeah, the ER is very, even though it works well for me as an ADHD person, sometimes that overstimulation comes in many forms. And you're like, I just need to take a beat.
Mhm.
I know some workplaces just aren't or have the ability for that.
Yeah. What advice would you give to other neurodivergent adults, or maybe specifically someone with ADHD entering the workforce?
I would say to be mindful of like where their headspace is at, especially because at least if I remember myself entering the workplace, I was just so excited, so
Mhm.
excited. And I felt like there was nothing that could dim that, right? But bad days will happen. And that I feel like to know, not to like expect it. I'm not trying to say like expect a really bad day or something like that, but to understand that it probably will happen
Mhm.
no matter how excited, no matter how good you are at that job, it's okay to have that kind of day. I remember somebody very wise gave me some advice about getting burnt out. And I was like, of course, that could never happen. And he was like, well, just be careful because, we all have been there as new grads where we're just so excited and they ask you to stay over a few hours, you do it, and then you do it again, and then you do it again. And
Mhm.
next thing you know, you're burnt out, you're so tired, you want to sleep for 2 days, you don't want to see anybody, that kind of thing. Not to mention, depending on what kind of work you do, the kind of burnout you experience can be very detrimental.
Yeah.
So just remembering, I think those things is, and that it's okay to have those overstimulated days where you're just like, I didn't
Mhm.
get much work done. I didn't do my best. It's okay to have those days. Even neurotypical people have those days.
Yeah.
So it's not the end of the world. Definitely be excited about your job. Give it all that you can give, but remember there are going to be days where you can't give 100%. That's okay. Again, come back and give it 110, or remember that, nobody's perfect. So if you mess up, just get back up, get back on that horse and do it again.
Yeah.
We learn from our mistakes. And that goes for anybody in the workplace, not just neurodivergence, but I know a lot of us are sensitive and take that to heart, so much when we don't give that 100% or we don't feel like we impressed somebody or like we were perfect.
Yeah. Do you feel that, knowing that you have ADHD and a kind of self-proclaimed people pleaser, so the people pleaser quality and then the ADHD, do you feel like there's this pressure to outperform and be 100% because you're afraid people might scrutinize you because like, oh, well, this is not the way that it's supposed to be done because she has ADHD. Like, do you think that there's a stigma there? That you're trying to get ahead of, or do you think that it's just not related?
For me personally, I would say it's not related. I think for some people it easily could be. But I think for
Mhm.
me, my people pleasing is deep rooted in my like childhood too.
Mhm.
I don't connect it or correlate it with my ADHD. I know that some
Hmm.
people definitely can have that people pleasing, that dynamic. I know that. But for me, I think it comes from something completely different that I don't associate it with that. So for me, I would say no. But does it affect my ability sometimes to be perfect in my mind? Yes. And so when I feel like I'm not being perfect, then, I'm like, how do I, do I go back on medication? What
Hmm.
what did I fail myself at today? What can I come like how do I manage my ADHD so that I'm better? Because that's like maybe in my head that's what's bringing me down. It's making me not
Yeah.
perfect
Yeah.
or not pleasing those people, but I don't think they're stigmatizing that. I don't think that they're thinking that, I guess, but I might be thinking that.
Yeah. What advice would you give to your younger self?
Be kind to yourself. Mostly be kind to yourself.
What do you wish people knew about this topic, being neurodivergent in the workplace?
I think maybe
Like,
just
what's the one
sometimes
thing you
like,
wish they just knew?
oh, wish I just knew. Is that again, like this is aside from like the ER. Well, no, it could be the ER. I know exactly what person I need to go to get the like let me back up. So when you just asked like what I wish they knew,
Hmm.
a lot of my coworkers and friends know if they need something absolutely done or they need to be taken care of, they can come to me right away and that will get taken care of. Whatever it is that they need in that moment,
Hmm.
it's going to get done. Whether it's for them personally, whether it's a personal struggle, I will make sure that crisis of theirs gets handled or whatever the case is. So it's kind of like knowing where my strengths are because maybe some of it's just my personality and maybe some of it's my ADHD, but be like, I bet you Stephanie's got that. Let me go ask her and I'll be like, I got you. Because actually I do. I do have that. Just kind of maybe, I guess, knowing what some neurodivergent strengths are,
Hmm.
like asking, like, hey, like, I know you're neurodivergent. What does that mean you're really good at? Like in a good way, like not like, what does that mean you're
Yeah.
good
Yeah.
at? So that they can play on our strengths. Because I think that's also for me, at least, a dopamine rush. If somebody's like, I know you're really good at this. So I came to you and I'm like, yay, like, yay, yay, yay. Yes, let me help you solve that puzzle. Or, oh my gosh, we need to talk about whatever chaos just happened in your life because I'm here for you and my heart hurts for you. So let's go through that. Whatever our strengths are, just asking what makes you
I
tick
love
kind of
that.
a
That's such a
question.
good idea.
Yeah.
Like, it's almost like, what if you could wear a pin that says, I'm neurodivergent, ask me what my strengths are?
Yeah, exactly. Don't ask me what my weaknesses are. Ask me what my strengths are because I got quite a few.
I mean, everyone has weaknesses, but I love the idea of this based approach where, like, all right, let's understand what the strengths are, and we could really play off those strengths,
Hmm. As opposed to,
versus mulling over the weaknesses, which is not productive.
yeah, yep. Most of
Yeah.
the time it's not.
Oh my God, super brilliant. I love that. I have a pin idea. My niece just
Yay.
got a pin maker for her birthday. I'm gonna put in an order. Like,
Yes.
I want
I'll
this
wear
pin.
one. Ask me about ask me about my ADHD. Ask me what I'm.
Oh, I love that. You'll probably
Yeah.
make a lot of friends wearing that because then people will
I
be like,
bet.
"Oh, I have ADHD."
I know. You? Me too.
Yeah,
You're
oh
not
my
alone.
God. I love it.
There's a
So
few of
fun.
us.
Stephanie, I'm so glad that you came on and shared
Yeah,
your
me too.
story and experience and ideas. And is there anything else that you'd like to say?
I know earlier I said be kind to yourself. Like that's the advice I would give, well, anybody really, but somebody young in the workplace with AD, stop with the negative talk. That's something I still struggle with. I have my own negative internal dialogue, but sometimes I have an external dialogue that I don't even realize. I've
Hmm.
had people pick up on it where I'm like sitting there, like kind of muttering to myself, and I'll be like, oh my God, you're so stupid. Why the F did you do that? Like, or whatever. And then somebody will be like, you're not stupid, and I'll be like, thank you, whatever. I was just literally just talking in my own headspace about like, how did you do that? Like, what? And somebody else hears my negative talk and they say it and I'm like, or they could, say, don't talk like that. And I'm like, you should hear what's going on up here. It's way worse. So
Yeah.
be kind to yourself from the beginning. Try to just make sure that negative talk never even enters your vocabulary. You find a way to get out of it. It's like people that do positive affirmations. It goes a long way. Whatever you
Yeah.
say is kind of what you put out. So speak kindly of yourself and
Yeah.
highly of yourself. Yeah.
Yeah. That's good. Thanks. I love that.
Yeah.
Thank you for sharing.
Yeah, absolutely. Thank you for having me.